As Nigeria joins the rest of the world to mark World Tuberculosis Day, health experts in the country have called on government to intensify efforts aimed at early diagnosis and treatment of the disease. They made the call during a sensitization walk around the city center in the nation's capital, Abuja. Our correspondent Joseph Idon compiled this report.
Tuberculosis remains one of the world's deadliest killer disease. According to available data, tuberculosis claims over 4,000 lives daily, and about 28,000 persons fall ill with the preventable and curable disease. This, according to health experts, is due to the lack of citizens' awareness of the disease. In a bid to curb this, Nigeria's National Tuberculosis Control Program has carried out a sensitization campaign to educate citizens more on the disease.
Sometimes you say something once, though you heard it, but it really did not sink. By the time you say it again, you have a better understanding. So that's why we're doing this again, to make sure that people actually understand. And we don't want them to only understand, we want them to get involved. We want them to be advocates.
In the last 3 years, the national program and partner have been able to move the case detection from less than 100,000 to over 200,000 as the last reporting period. For me, that's a very substantial effort. And in doing this, they have been able to increase the treatment coverage, which as at the last report in Global Fund is about 44%.
While distributing materials to residents, representatives of the federal government on ground say several measures have been put in place to ensure tuberculosis services are freely available to the public. However, experts available say there is a need to scale up sensitization efforts aimed at curbing the spread of the disease.
The diagnosis of TB in every community throughout the 36 states of the Federation and FCT is free. Not just that, the policy also states that the treatment of diabetes and tuberculosis is also free.
Most of the cases we are seeing presently actually coming from the community. If you look at the NTBSCP last report, it actually shows that 40% of the cases are coming from the community. And that's why National Program and Partner had intensified efforts to ensure that we push TB case finding within the community.
Surprisingly, when you meet some migrants, some of them are not even aware. Some would have said, I've never heard of TB. And that is so ridiculous, being at the stage at which we are in the fight for TB. So awareness is very key in the fight for tuberculosis. As at the stage where we are in Nigeria, so International Organization for Migration is solely interested in helping the publication and TB media publication all around the country, apart from just Abuja, and ensuring that people are aware of the fight that we are in presently.
The local health systems in African countries is doing all they can to address this issue, and but they are overworked, understaffed. So definitely the health system itself needs more funding. We have in our arsenals the ways to treat it, because the medication has been invented and it's effective. But what we have seen is that over the years, because of many of the people who suffer from TB are poor, have poor nutrition, do not have access to very good health care. So sometimes they fall out of the treatment regimen.
With the World Tuberculosis Day presenting an opportunity to review tuberculosis diagnosis and treatment in Nigeria, experts say they are committed to achieving zero tuberculosis cases by 2030.